Hi, welcome to this special IAPP Keynote panel, The Platform's Way In, Privacy, Exposure Notification, and Contact Tracing. The past few months have been uncharted territory for all of us, and that really means all of us, citizens of the world, as we deal with the COVID-19 pandemic. This crisis has far-reaching implications for public health primarily, of course, but also for the economy and for society writ large. It also has brought a wave of new issues and implications for us privacy professionals, issues such as working or studying from home on virtual platforms, returning to the office, trying to keep employees safe while protecting their rights and privacy, healthcare research, and much, much more. As we work through all of these issues, technology is a valuable tool that can and should aid policymakers and public health officials fight the pandemic. One central issue that we have seen is the testing, tracking, and tracing of new patients. Of course, contact tracing is an age-old practice, as Nicole will later elaborate. Public health officials have deployed it for many, many years. But now technology can digitally assist in identifying individuals who were exposed to the virus and alerting them to get tested and to quarantine. As providers of the dominant operating systems for a vast majority of smartphone users, Google and Apple have been at the forefront of this discussion. And they came together to remove barriers from and to enable the development of exposure notification applications. It's a special privilege for us to host the leading privacy officers at both Apple and Google in one session, respectively, Jane Horvath from Apple and Keith Enright from Google. And that's an even greater privilege for us to have this session moderated by Nicole Wong, who has a long and illustrious career in privacy and tech policy, formerly the Deputy Chief Technology Officer for the United States in the Obama administration. So with this, I will hand it over to you, Nicole.
Perfect. Thank you so much, Omar. And thank you for hosting this conversation. It's a fascinating topic in a deeply challenging and uncertain time. So I'll just be facilitating our discussion, but truly my two friends, Keith and Jane, need very little assistance from me. I had the privilege of working with both of them, what seems like several lifetimes ago when I was at Google, you know, when we chiseled privacy policies from stone tablets and things like that. But it's a delight to have this reunion with both of you today and to see you and your companies working together on this really important joint project. So maybe to start, I'll do a little bit of a setup and then I'm gonna let both of you talk about the work. The exposure notification system from Apple and Google, and we're gonna need a shorthand for that at some point in this conversation, is a tool to improve the ability of public health agencies to do contact tracing. So for those who aren't steeped in that topic, it might be worth a couple minutes to explain why that's important. As Omar said in the introduction, contact tracing is not new. It dates back to the 19th century. It was used to identify the actual typhoid Mary in 1907 as the source of the outbreak of the disease in New York. It's particularly useful for methods of diseases that are transmitted by droplets in the air or by direct human contact. Hence its importance today with the transmission of COVID-19. But it was also used in the campaign to eradicate smallpox, which was finally done in 1979, the SARS outbreak in the US in 2003, the Ebola outbreak in Africa in 2014. In a nutshell, when someone's diagnosed with one of these highly contagious diseases, the diagnosis is shared with the patient and her doctor, and also the local public health agency. And then that agency assigns a contact tracer to follow up with the patient about her symptoms, her close contacts during the period of infection, and to come up with an isolation plan. And then the tracer goes and finds all of that patient's contacts to see if they are also ill and to monitor them for some period of time for possible infection. So that's it in a nutshell. I think it's also important to know that the tracing is just one part of a three-pronged public health program, which we've now heard repeatedly in recent months: test, trace, and isolate. And so here with your joint project, Jane and Keith, we're focused on that trace part of the strategy. So with that background, why don't we start first with an explanation of the Apple Google Exposure Notification System and what it does.
Great, Nicole, thank you so much. And it is a pleasure to be on a panel with the two of you. And I also want to thank the IAPP for hosting this panel. Nicole gave a little background on what contact tracing is. And as you were listening, it really involves a lot of contact tracer, ask a person who they've been in contact with. But we all recognize the reality of the world that we live in today. We come into contact very often with people we don't know. And so early on in the pandemic, there was a lot of thought of how could cell phone data be used to do contact tracing. And there were a number of reach outs from public health authorities to both Google and to Apple. And people were looking at existing technologies that the telephones had, including location, including Bluetooth, and none of those were really the right thing. And so we realized that we could use Bluetooth technology, a modified version and a more privacy-friendly version of Bluetooth, to help with the contact tracing. And in a minute, I'll walk you through a schematic that shows exactly how this works. But essentially, we developed exposure notifications, which is a type of Bluetooth that allows for you to receive notifications on your phone. Do we have the presentation up? So they allow you to receive notifications on your phone if you test positive. The important thing here, and it's something that Keith will discuss in more detail when we talk about the privacy features, is we had a decision to make whether we wanted to share, whether this technology was going to basically send these indicators to a centralized place, or whether we could use device processing and thereby be more privacy friendly. So exposure notifications uses device side processing. And so all of your contacts or potential exposures are actually stored on your device. And only when you are diagnosed is a report made to the public health authority. Again, as I was saying earlier, it's really meant to augment the existing contact tracing efforts. It's an attempt to help find all of those people that you actually couldn't identify to a public health authority when you went in for a post-COVID diagnosis, to tell them all the people that you had been around. And then the most important thing here is we are working very, very closely with the public health authorities on this. So Google and Apple have developed a technology, and it's a technology that will allow, if you are sitting, it doesn't matter whether you have an iOS device or whether you have an Android device, you will be able to exchange these exposure keys. And so they're interoperable. But the public health authorities are going to decide how the notifications will be triggered, what the next steps are to advise someone who's been possibly exposed, and how to reach exposed individuals for further contact and containment initiatives. Next slide, please. So how will exposure notifications work? This shows a graph of potential people coming into contact. We have 2 slides with a schematic that walk through a potential exposure. Next slide. So Alice and Bob are sitting on a park bench. They've been out for a walk. They don't know each other, and but they're not sitting more than 6 feet apart, and they're sitting there for a bit of time. And Bob is then subsequently diagnosed with COVID-19, and as part of the process, he actually has to enter the test result into the app from the public health authority. So I need to back up a little bit. So the important thing is Alice and Bob have already downloaded the public health authority's exposure notification app. Since I live in San Mateo County, we will assume maybe it's the California exposure notification app that each one of them has downloaded. So, and they're carrying their phones in their pocket. So Bob is diagnosed, he enters those results into the California app, and this is all hypothetical because we don't have that app yet. And he enters the test results into his public health authority. And when Bob and Alice were sitting on the park bench, their phones were actually exchanging beacons to show that they had been in contact with each other. And you can see in this schematic that they were in contact with each other about 15 minutes. So each phone exchanges their exposure notification keys and they stay on device. So when Bob is then test positive, he enters it into the public health authority, and with Bob's consent, meaning he will actually have to take an affirmative action to say that he wants to upload the last 14 days of his keys to the public health authority to the server of the public health authority. Next slide, please. So Alex continues her day unaware that she's been near a potentially contagious person, but her phone is busy periodically downloading the Bluetooth beacon keys of everyone who has tested positive for COVID-19 in her region. And if a match is found, and here a match is found with Bob's random Bluetooth identifier, and so her phone says, got a match, and the app then triggers a notification. That notification is something that has been written by the public health authority. Here is just an example: alert, you've recently come in contact with someone who's tested positive for COVID-19, tap for more information. And Alice's phone will receive a notification with information about what to do next. Now Keith is going to talk about some of the privacy protections that we've built into this technology. Keith?
Thanks, Jane. Next slide, please. So just sort of elaborating a little bit on what Jane has already said, when the COVID crisis surfaced, there was a tremendous amount of energy inside of Google, and I'm sure inside of Apple as well, at all levels of the company, trying to determine how we could help. What could we do to leverage our skills, the things that we do well, to assist public health authorities in responding to this crisis as efficiently and effectively as they could. Initially, we received a lot of inbound questions about location data, like maybe you would be able to use location data to support contact tracing. And it turned out that wasn't actually the right data set for a whole bunch of reasons. It's not complete enough, it's not accurate enough, and obviously there are very strong privacy concerns associated with location information that could be derived from somebody's device. But serendipitously, in a bunch of places, roughly in parallel, folks started talking about Bluetooth proximity as a potential avenue for supporting contact tracing efforts through some sort of elevated exposure notification. So we were having conversations with experts in academia and in other areas, and sort of came to our friends at Apple and kicked off this conversation about, okay, maybe we could collaborate. Maybe there's something we would be able to do that would allow us to expand the speed and the scope of exposure notification in a way that was optimized for privacy protection. And that was really the mission that we took on. We knew we can't solve the problem of contact tracing. We can't deliver that. That is up to public health authorities. They've been doing it for a very long time, as Nicole was laying out. What we can do is try to leverage the unique capabilities of technology so that we can allow contact tracing to get better data faster, and allow sort of that information to be used to notify people who have been exposed more efficiently, based on criteria that are set by their public health authority, so that they can respond responsibly. And hopefully we can slow the spread of the virus and help get people back to work and get the economy moving again. Some of the key decisions that we were making in the course of the early design phases of this, it was absolutely essential to us that users have to explicitly consent to turning on exposure notifications. And we want to make sure that they have the ability to turn them off at any time. User control was essential to this. We did not want to create a system that was not completely transparent and persistently under the control of the user. We also wanted to make sure from the beginning that this doesn't collect or use device location information. including for users who have tested positive. So we've gone to great lengths to ensure that all of the apps that call the APIs that we're making available adhere to sort of strict guidelines that we have issued that prohibit them from collecting or using device location information. We also want to make sure that users themselves decide whether they want to report a positive diagnosis. This isn't something that's automated. Users remain in control. User identities won't be known to other users. So this technology at its core is fundamentally anonymous, especially to Google and Apple. We do not know a user's diagnosis. We do not know their identity by virtue of them using this technology. The key design feature, perhaps beyond everything else that has been sort of the focus of most of the external discussion around this, has been our decision to be sure that matching for exposure notification is done on the device, under the user's control. There were alternative designs that were proposed and were very actively discussed, where you had central servers that were doing more of that processing and more of that association of diagnosis keys with individual users. We pushed back hard on that, and we felt strongly that all this exposure notification information being done on device, that processing being done under the sort of strict control of the user, was an essential design feature to optimize for the privacy of the system. The system's only to be used for exposure notifications by public health authorities, and it's not going to be monetized. Now, hopefully this would go without saying, but it's worth saying explicitly. Our intention here was to be very, very rigorous and very strict in only allowing these APIs to be called based on recognized, authorized public health authorities who are designing apps for this specific purpose. And of course, none of this information is going to be used for anything that makes any revenue for Google or for Apple. Finally, for this slide, Google and Apple, we intend to disable this exposure notification system on a regional basis when it's no longer needed. So we will remain in close partnership with the national health authorities, and when the present crisis has passed, and we do not feel that this technology is necessary anymore to contain COVID-19, we intend to shut it down. Next slide, please. Now, in furtherance of that relationship with public health authorities, we've really put a lot of thought into the policies and procedures that will govern the way that these APIs will be made available and how they can be used. Users, as I had said before, they have to explicitly consent to turning on exposure notifications. They also will only be consenting for purposes of these specific apps that are created by or for government public health authorities. And the use of the data that's sourced by these APIs is strictly limited to be used for COVID-19 response efforts. As I had said, these apps must require the consent for users before the app can use exposure notification. Users are choosing to download these apps themselves, and once the apps are installed, they have to operate within these sort of strict constraints that have been defined for them. Again, even after the app has been installed, the app has to require users to consent before sharing a positive test result. And as part of that notification, sharing the associated keys with their device back to the public health authority. There's a privacy by design principle that's at the core of this technology, and we're requiring that apps only collect the minimum amount of data necessary and only use that data for their COVID-19 response efforts. All other uses of that data, including for things like targeted advertising or anything else that was intended to generate revenue, are strictly prohibited and will not be allowed as part of this technology's kind of use and deployment. One really important point to emphasize is that we are prohibiting apps from seeking permission to access location services. And again, there was that early design decision as to whether location information would be necessary for exposure notification. We have instead decided to focus on Bluetooth proximity, and we are prohibiting apps from seeking permission to also access location service information from the device and appending it to the Bluetooth proximity data or to any kind of identity information. And then finally, the use of these APIs is actually going to be restricted to one app per country. Country is a little misleading. What we actually mean is per jurisdiction, per health authority. So this is to promote a high user adoption and avoid fragmentation. We want to do everything that we can to optimize this entire system for trust. We recognize that people are going to be reasonably skeptical before installing an application that's going to be doing these things. So we want to make sure that we are creating the simplest possible framework subject to these really rigorous and very strict constraints. And then we want to put national health authorities in the driver's seat in terms of controlling which app is going to be approved within their jurisdiction and some of the ways that app is going to operate as to users that are operating within that region. So we want to minimize the number of apps to sort of the minimum rational number for the number of health authorities that we're dealing with to maximize adoption and make this deployment as useful and as effective as possible.
Excellent. Well, thank you both. And that was a really great explanation. And I appreciated the sort of focus on the design choices, but let's dig a little deeper there, because we're talking to a set of privacy professionals. So maybe some of the tactics around that actual process of design, right? Not only to meet the need from a public health standpoint, but also the design from a privacy standpoint. And so I'm thinking of things like, who helped you figure out that like 6 feet would be the right distance to determine whether there's going to be an infection? How did you think about that in terms of putting the design on the table? Talk more about the difference between location, which I think has been historically the way contact tracing as a mental model thought about it, versus like the proximity distancing. So like maybe talk a little bit about that design process, and did they start separately in each of your companies and then you converged, or did you all gather together at the same time?
So, to answer the last question first, I think we've been in a lot, and it also answers the first. Basically, we were in contact with the public health authorities early on, and as Keith said in his remarks, both companies wanted to see what we could do to help out with the pandemic. And we had been in discussions with a lot of health authorities that were early considering the contact tracing and whether cell phones could be helpful. We, recognize that we are not experts, and we do have experts on staff. Both companies have medical doctors on staff that work on our health projects, so they were very, very influential in the design. We also reached out to the CDC, European authorities, data protection. We briefed the Irish and the UK and data protection authorities throughout Europe and the APAC region very early on to talk to them about the privacy features. And it's really been trying to figure out how to balance what we want to be a very private technology, but still make it useful. And there have been a number of different press reports that are challenging whether we are too private, which is an interesting place to be. But the other thing that needs to be considered, if we are less private, and I think we're seeing that play out right now, if we're less private, less people will download the app. So you have to reach the right balance between privacy and effectiveness. So hopefully we'll get a big uptake in people using it. And Keith, I'm sure you have more to add.
Yeah, no, I agree with all of that. I think a couple things that I would amplify. One is clearly we recognize coming out of the gate here that we are not a company whose core competency is epidemiology or virology. So I think we approach this with an appropriate level of humility. We had leading researchers from medical schools around the world coming to us. It was a really interesting moment where we had this unsolicited but serendipitous engagement from leading thinkers across all fields that were relevant to what we were thinking through. We had some of the world's leading cryptographers come out to us, sort of sharing their research, sharing their thinking, saying, we think that there is a way that you might be able to help, but we would like to share our research and share our perspective so that you're doing it in the most secure, anonymized fashion possible. So there were these tremendous dialogues between the Google research team, the Apple engineering team, the various academics around the world, where we were kind of gut checking, challenging some of the assumptions. That's been interesting and fascinating. The other point that kind of I want to push a little bit from what Jane had said is I think we are confident that what we are trying to do here will be helpful. But again, we need to approach what comes next with an appropriate level of humility, right? We are moving in somewhat uncharted waters. We are trying to apply the benefits of technology to a well-established, to traditional methodology of contact tracing. And we will adjust course as we go. We will improve as we learn. But there were all sorts of decision points along the way. One that I want to make sure we don't presume is that privacy and efficacy have actually been in tension, because nothing I have seen to date supports the proposition that privacy and efficacy are going to be in tension. Jane is exactly right that penetration, ubiquitous adoption, all of that, those are presumptively going to be really important in this being effective. But I'm also seeing research suggesting that even with relatively low adoption rates, contact tracing and by extension exposure notification might have substantial public health benefits. There's a great deal that we don't know, and I think we are going to be learning right alongside the public health community and others as we go along through this journey and continue optimizing our approach to try to deliver the greatest benefit.
It seems like one of the defining differentiators for your API versus other models is centralized versus decentralized matching. And help me out, because I'm not sure I totally understand. Each one involves some centralized server, but for the Google Apple one, it's like the limitation of the matching is really about hosting positive cases that are consented to be put into that centralized server, right? Versus, tell me more about what the other model is. Like, is it that other public health authorities who decide they want a centralized server have more information about the user? And maybe talk a little bit about the pros and cons there.
So with the centralized approach, if we looked back to Bob and Alice in our schematic, as Bob and Alice are sitting on the park bench with a centralized approach, those exposures are being sent up to a central server to mediate, regardless of whether either Bob or Alice had COVID. There would be a server that was just essentially keeping track of all the people that you would come into contact with and could potentially have been exposed to. So then when Bob subsequently gets diagnosed with COVID, the centralized server will do the matching and then send down a notification to Alice that she may have been exposed. And generally, in a centralized approach, they could or may know the identities of the people that are exposed. There's more, and I think there's been a lot of work on the centralized approach to minimize the privacy impact as well, to be quite fair. On our approach, there are keys that are sent up to the server, but they are sent up to the server only on consent of Bob, because remember, Bob was the one that had the positive diagnosis. He worked with the public health authorities. At the point that he wanted to notify the people that he had come into contact with, he made the decision to send those keys up. And so there's a lot more control and trust put in the individual in the exposure notifications model. But because we think if you give people transparency and control, they will do the right thing. That is why we went with the model that we went with, because the centralized model does have the potential, and I'm not saying that it always does, to build a social graph of everybody you've been in contact with.
Yeah, as Jane acknowledges, one of the things that struck me across the course of the project was there were very thoughtful, very reasonable, privacy conscious people on the other side of this debate around centralized versus decentralized. And they sincerely sort of believe that there are performance benefits to the centralized model, that having access to more information by the central health authority will equip them to sort of do certain things more effectively. We didn't see evidence of that. And when we weighed the potential privacy risks of the data being repurposed to assemble sort of a contact graph that we thought was a potentially sort of significant privacy risk that we wanted to mitigate. And from everything that we saw, we felt like we could deliver all of the efficacy benefits of the model via the distributed system where that processing was done on device as opposed to by a centralized server. We committed to the course of decentralization. And at this point, it feels like that's where the center of gravity is. The debate continues to shift and there's still a lively external discussion. There are a handful of jurisdictions that remain sort of to pursuing the centralized approach, but most jurisdictions are now leaning towards a decentralized approach and are signing on with our APIs, which we're taking as a signal of validation that we're weighing the equities and the privacy risks here appropriately.
That's great. I think you both gestured to some of the limitations that might come with this, right? So one of them is just smartphone penetration might limit how many people actually adopt this. There could be bias in the population of who has smartphones. I think that the most recent data is really old people and low income people are less likely to have a smartphone, not by huge amounts, but 10 to 12%, I think less than the general population. So those are actually, as it turns out, the most vulnerable of the populations for COVID. So that's an important thing to think about. But it also strikes me that and this is putting a little bit of my public policy hat on, right? One of the biggest limitations may be the technical capacity of any given public health authority to know how to, because as I understand it, you're gonna put them through some sort of verification criteria, and let's put a pin in that and talk about what that criteria will look like. But also they have to actually develop the app, host the data, maintain it, and then follow up with the tracing, which is a lot for, at least in our country, to ask of public health authorities who have been, many of which have been defunded over decades. So could you talk a little bit about let's go to the public health authorities that you've met with, the criteria you think about when deciding whether to license the API to them, and some of the challenges they may face taking on the framework.
So on the subject of the public health authorities and how we decide, we have a special review group that's looking at these applications by public health authorities. And we want to make sure they are the public health authority for the region. One of the things that is still being discussed across the globe when people are looking at using exposure notifications is, as Keith focused, the exposure notification will be able to be used by one country or one region, but there can't be multiple entities in a region using the EN API. So figuring out who the authorized public health authority is, and again, it's a lot of outreach, it's a lot of discussions, and talking and putting our technologist on the phone with the public health authorities to help them discussing some of these issues. We've been trying to be as helpful as possible, recognizing that we are not public health experts.
Yeah, I agree with all that. I think responding to the front half of your question, Nicole, there are an array of public policy challenges associated with this, many of which I've come to understand better than I ever expected to, and still don't understand half as well as I should, that sadly we are not well positioned to solve, right? Like many of the challenges around disproportionately affected populations and access to technology and access to connectivity, there's a lot there. What we are focusing on is making the APIs as effective and as safe and as privacy protective as possible, and then working with the public health authorities to support them in implementing the APIs in whatever app it is that they decide to build. I think they're learning from each other as well. Like we're seeing a great deal of interaction, public health authority to public health authority, which is encouraging. And hopefully that will also have knock-on effects across governments generally, which may, shine light on some of the other adjacent issues that I think they're going to need to think about to maximize the effectiveness of the work. But in the short to medium term, getting the APIs sort of optimized, getting them deployed as widely as possible in apps that are functioning as intended in as many jurisdictions around the world as possible, and then focusing on promotion and adoption. I do think there is a significant impediment to this, which is making the message simple enough and compelling enough and transparent enough that users can make an informed decision saying, I want to install this because it is the right thing for me and for my family and for my neighbors and for my society, for the people around me. This is actually going to reduce the material risk. That's a hard lift, right? Like holding people's attention long enough and communicating all of the essential information to help them feel like they're making a fully informed choice to install this app, to enable the app, and then to subsequently consent to exposure notification. There's a lot to do there. And we're focusing right now on working with national health authorities to equip them to do that bit as effectively as they possibly can. If we can do that, which is a substantial if, then I think a lot of these significant adjacent problems will come into focus, and then folks can begin diverting their attention.
I think there's at least one, maybe two bills in the federal Congress on data collected in the process of the COVID response. And I think certainly in Europe, a lot of the data protection authorities are now issuing guidance about how do we start collecting data, particularly in workplaces, about COVID exposure. Is there something to either of your minds that public policymakers ought to be doing to make this better, clearer, more protective? What are you seeing out there that feels like the right thing to make this go faster?
I think, one of the things this points out is the fact that the US doesn't have an omnibus privacy law yet. And that's something that we've been very supportive of. I think within Europe, we see the Commission, the European Data Protection Board, and the DPAs all working within the framework of GDPR. And so there are guidelines there that are hopefully giving more consumer trust. And I think within the US, and one of the reasons we're seeing bills in the US is because the real thing that's going to help in making this work is consumer trust. And people are worried about secondary uses of data. And as Keith made clear, Apple and Google don't have the data. The data will be sent up to the public health authorities. And there are state laws and health laws that will cover some of this, but I think that the main goal here is to give consumer trust.
Yeah, I agree with what Jane is saying. One other thing that I would emphasize as we talk about COVID privacy specific legislation and how that dovetails with this notion of a much needed general federal omnibus privacy law, it's important that we don't lose sight of the fact that here at issue, it's primarily government agencies gaining access to certain types of information. So we need to make sure that whatever privacy protections we're providing are privacy protections as to government entities. Like, this is not a situation where we're actually talking about substantially creating a new privacy risk from private sector companies. This is something where we need to make sure protections are being expansively applied so that users are getting strong rights and protections relative to government access and use of data.
In our last couple of minutes, is there another phase to this project for you? I like seeing you guys work together. I miss that. And what else? Any other innovations that either of your companies are planning, or any other last thoughts on this issue?
Well, I think as we've made really clear, we're talking about public health authorities a lot, and there are different needs across the world. And so we're looking at different recommendations, taking in a lot of feedback, discussing ways to address different issues. So we are still developing. Keith and I are still coordinating quite a bit. But I don't see any change in the core privacy commitments we've made. The technology may evolve.
Yeah, echoing that, I have been supremely grateful for the privilege and opportunity to work with Jane again. She's been a friend and mentor for a very, very long time. So that has been great. And, this crisis has presented us with opportunities to sort of think top to bottom about different ways that we can help solve some of these societal problems in ways that are privacy protective. I mentioned at the beginning that one of the initial approaches was how location data might be useful in responding to this public health crisis. And our initial reaction was not the right data, privacy risks are overwhelming. We actually had teams in parallel with this spinning on that particular problem, which resulted in something that we called the mobility reports, where we took anonymized aggregated data sets and made them available to public health authorities in different contexts, which allowed them to do things like interpret the traffic patterns to hospitals, so they could understand like where were they actually seeing traffic spikes, how can they be allocating finite public health resources in a way to deliver maximum benefit. The fact that we have the ability to do that in a more privacy protective way than was ever possible before is just another example of the way this sort of thing can drive innovation, and can drive positive outcomes.
Great. Well, this has been wonderful for me to have an opportunity to hang out with both of you again. And so just in closing, for you and your families, stay healthy and well.
You as well. Thanks so much.
Thank you. This was great.
Thanks.